Hello, and welcome to our long COVID discussion with Dr. Schwelt and Salam Kabbani, author of COVID Long Hauler, My Life Since COVID. Today, we will discuss some key topics related to long COVID, including some practical concepts related to defining long COVID and what to do for clinical support or additional support. My name is Janan, and I'm the CEO and founder of Global Bookshelves International, and I'm excited to introduce our two guests. So first, Dr. Roger Schwelt. He's an individual with many roles and talents. He's a physician, a pulmonologist, a professor, lecturer, preceptor. He's quadruple board certified in internal medicine, pulmonary diseases, critical care medicine, and sleep medicine through the American Board of Internal Medicine. There is so much more, and I'll share in the bio below, but his passion is demystifying medical concepts, which is how we connected through his amazing series on YouTube and his company MedCram, where he provides evidence-based updates on COVID-19 and CME for physicians. Dr. Salam Kabbani is also here. She's an infectious disease pharmacist by day, and by night, she's a book connoisseur. Now she's a published author and wrote the book, COVID Long Hauler, My Life Since COVID. She serves as a preceptor. She oversees patients with infectious disease, ranging from COVID, endocarditis, HIV, and so many other infectious diseases. So I really look forward to begin. As I mentioned, today's topic is long COVID. There are two very qualified individuals to talk about this discussion. So I wanted to thank you both for joining. And Dr. Schwalt, I'll start with you. First asking, is there anything more you want to introduce yourself that I didn't mention that would be relevant for this conversation?
No, I think you did a very good job. First of all, thank you very much for inviting me. It's a pleasure to be here with both of you, Janan and Salam. And I do see patients in the clinic. So that is one thing that I do. And I have some anecdotal stories that we can share as well as we go along and we talk about this. But it's a pleasure to be here.
Thank you so much. Well, I'll go ahead and start with you and ask you a little bit more about what you're actually seeing in the clinic related to long COVID in terms of the common symptoms patients have when you see them. Is this, quote unquote, real, this concept of long COVID?
Yeah, it's very real. Many people get symptoms after a viral infection that lasts for quite a while. That's not unusual. What's unusual, and actually what's the definition of long COVID, is when this has gone on for more than 12 weeks. So because I'm a pulmonologist and a lung physician, people are going to be sent to me primarily because they have the symptoms of shortness of breath after COVID for more than 12 weeks, sometimes even less than that. But that doesn't mean that there aren't other symptoms as well. It's just that because I'm a pulmonologist, I'm going to be getting those from primary care physicians. But in terms of other symptoms, it's a very broad and very diverse set of symptoms. It can be, the biggest one is fatigue. About 58% of people with long COVID will complain of that. But the list goes on and on. 44% have headache. 23% may not be able to taste correctly. They might have brain fog, inability to think clearly, and to organize their day. I've had patients in my clinic literally break down in tears because they knew that they were mentally capable before they got COVID, but now they can't. And I've seen this in a number of patients. I would say over the last year or so, when I'm in the clinic, and I'm in the clinic maybe once every 3 weeks, I'll get maybe at least 5 or 6 patients a week that are coming in because of post-COVID.
That's incredible facts. I really appreciate you sharing that. And the incidence is, kind of astounding. And I'm curious on that note, do you know what the studies are saying about the incidence of this long haul COVID?
Yeah, so there's been a number of studies that have been published. There was one that was published in 2021 in April. It was a research letter that was actually published looking at, in Sweden, 300 healthcare workers, 60 days post, compared to people that were that were not positive for SARS-CoV-2. And what they found, that 26% of those people that were post infection had symptoms versus only 9% of the same sort of symptoms that were seen in the SARS-CoV-2 negative cohort. At 8 months out, that number dropped from 15% in the post-COVID versus 3%. So you can see even 8 months out, there was a large difference. There was another study that was published in April of 2021, this time in the United States, looking at 1,600 subjects, 60 days post-discharge from the hospital. So when you're in the hospital and you have COVID there, the chances of you getting a post-COVID type of diagnosis is higher because you had more severe. They noted that in the COVID patients that were discharged, 33% had worsening symptoms, 33% had persistent symptoms, 19% of them had worsening symptoms. The most likely or common was 24% with shortness of breath on stair climbing, but other symptoms included cough, loss of taste or smell, and this was published in the Annals of Internal Medicine, so pretty well documented.
Absolutely. That's really interesting that, this is happening. People are having these experiences and these symptoms. So when you speak to patients or recommend things for support for these patients with long COVID, what are the things that you are telling them to do? Or what are ways that they can identify that they're having this long COVID based on what you've shared?
Yeah, so most of these patients that come to me are having significant shortness of breath. And so what my first job is to do is to make sure that they don't have a medical diagnosis that may be explaining the symptoms. And with COVID, one of the very likely things that it's potentially possible that you have to rule out are blood clots. So all of these patients that come to me and see me, I will be getting something called a D-dimer test to see if it's elevated. If it is elevated, then I will do further testing to make sure they don't have blood clots in their legs and their lungs. We'll order a pulmonary function test. We'll get a chest X-ray. So we'll work up, in other words, all of these symptoms, not assuming that they're related to long COVID, just to make sure that they're not something else. And that's important because people may have COVID and they may start developing symptoms. And the assumption may be that it's related to COVID. The first thing that we need to do is to make sure they don't have something else that we're missing. In some of those cases, I've actually found some patients with blood clots. And although that wasn't the majority of them, we were able to get them on appropriate anticoagulation. Now, that's not to say that COVID can't cause blood clots because it's well known to do that, but you need to make sure that you're treating the blood clots. So if I have a patient who comes in with shortness of breath or other symptoms of COVID-19 post like 12 weeks later, and all of those things are negative, then there's a number of things that we start to do. So, what do I recommend? And it harkens back to a gentleman that I had just about 2 months ago. He was a gentleman that was very frustrated because he had long COVID for a year. And nothing was getting better. He would get these intermittent bouts of shortness of breath for about 8 out of 10. And he also had significant gastroesophageal reflux disease, which is where you feel heartburn. He wasn't sleeping very well at night. And we had gone through all of these things. I had checked him for blood clots. I had checked him for clots in his legs and his lungs. I had checked an echocardiogram to make sure he didn't have elevated pressures in his lungs, etc. And so I was basically left at the end. We don't really have a lot of randomized placebo-controlled trial data that answers what the solution is in this. We have one study that showed that vaccination after long COVID, actually improved slightly in those patients that received vaccination. It didn't really depend on which type of vaccination, but it seemed to help. And the theory there is that that perhaps the virus is still circulating around and causing problems, and the immune system just needs that boost to get rid of it. We did not do that, but one thing that I thought about and I've been researching about and looking into is the idea of damage, the damage that the virus does to the body. And this damage particularly is in the realm of the mitochondria. Now, we can talk a little bit about the pathophysiology of this, but basically, there's been a number of studies that have come out implicating energy machinery in the mitochondria of the cell. Now, that's important to understand because the mitochondria is the portion of the cell that makes energy so the cell can survive. And the mitochondria is multifaceted. It can burn fats, it can burn carbohydrates, it can burn proteins. And some recent studies have shed light on this to show that its ability to burn fat is impaired in patients with COVID-19, and more specifically, that patients who are infected with SARS-CoV-2 and have COVID-19 have a lot more oxidative stress in the cells. Okay, So knowing that and understanding that, there's been some recent data that has come out. It's not 100%, but it's suggested that exposure to near infrared radiation or light can actually improve the secretion, the production of melatonin inside the cells where they're needed in the mitochondria. Why is that important? Because melatonin is a very powerful antioxidant and potentially a substance that could mop up a lot of the damage that is occurring. So I started to recommend to my patients getting outside more, getting into the sunlight more, because the sun is the biggest source of infrared radiation that we have. We've lost the ability of infrared radiation inside buildings because glasses, the windows are now designed to filter out near infrared radiation. The bulbs that we put, the LED bulbs, have also been designed now to just have visible light. So really the best way of getting near infrared radiation is to get out in the sun. And if you look back at studies that have been conducted over a century, we see that people who get outside more often, people who are out in nature, have better metabolism, have less diabetes, all these things that are associated with oxidative stress. Okay, so that's one thing that I knew on this day when I was talking to this gentleman. The other thing that I've been studying about is fasting. So fasting is the first inclination that I had when I first started to study about this is fasting is something that you want to do if you want to lose weight and that sort of thing. This has absolutely nothing to do with losing weight whatsoever. The properties of fasting, which have been well documented over the last 10 to 20 years, is that when you fast, and what I mean by that is when you have a period of time during the day when you're not eating, and this could be anywhere from 4 to 8 hours, even longer, your body switches its metabolism from burning carbohydrates to burning fats. And that's important because it does more than just that. When you have the burning of fats, it produces a byproduct called ketones. Ketones actually signal the body to, instead of building, to actually break down and repair. And this is the reason why I was very excited about this, is because I believe that the virus and the inflammation that the virus caused has damaged a lot of our cells, damaged a lot of our mitochondria to the way that it's not functioning in the way that it should. And so by fasting and allowing the body the time to repair the damage that has happened, we could build back in a better way and protect it with sunlight. And so my prescription for this gentleman, and this happened about 2 months ago, so I'm new at this as well. I told him, look, I don't have a randomized controlled trial data to give you, but this is my advice based on all the information that I know right now. Get outside more often, get outside at least half an hour a day, okay? And start to institute intermittent fasting. And I explained to him why that was important. And specifically what he adopted is that he would have breakfast at around 8 or 9 o'clock in the morning. He would have, and then he would have a second meal, but he would never eat past 5:30 with this new regime. Prior to that, he was eating well past 5:30. He was snacking at night, doing all sorts of things. So I said, okay, we promised that we would do this. He seemed very enthusiastic about it, and he left, and I had an appointment to see him back about a month or two later. So about a month or two later, this gentleman came in, and he was excited, notably excited. And to be honest with you, we spent the entire half-hour visit talking about what changes he had noted in his life after just a year of trying everything to get rid of the shortness of breath. He said his shortness of breath went from an 8 out of 10 to a 3 out of 10. In fact, he says it didn't even actually bother him. It wasn't a source of irritation, and it actually didn't even impact his quality of life. He said that his gastroesophageal reflux disease completely went away. Now I realize that this is an anecdotal story, but it was very powerful because the only thing that he changed in his life was doing those two things. He got outside more, and he did intermittent fasting. And I have to believe, based on the data that I am seeing, that this is a potential salve, if you will, or a treatment or ointment, if you will, looking at the old way of talking, for COVID-19, which I believe is simply a condition where the virus has wreaked havoc of inflammation all throughout the body, and the body needs a chance to repair itself. But because, at least here in America, because of our technology and because of our wealth, we are able to do anything that we want. But the problem is that the habits that we are forming are not conducive to repair and rest. For instance, you can walk into a Denny's, and Denny's is a restaurant here in the United States. And when you walk into a Denny's, you look up, and I'm not picking on Denny's because there's a lot more of them than this, but you see on the wall a menu for breakfast, you see a menu for lunch, you see a menu for dinner, and then you see a menu for late night. Okay, so what's late night? Why are we eating late at night, and what's the purpose of that? The other thing that we have are, smartphones and iPads. These are things that we stay up late with, and the eyes shine into our eyes, and that shuts down melatonin production, something that else could be very beneficial at protecting us against it. So this is a very long answer to your question, but your question is what am I recommending to my patients now after I take them through that whole thing? And I make sure that they don't have a condition that I'm missing, and we're left with this syndrome called long COVID. These are the two areas that I believe are central to at least getting patients back to where they are. And I've been hearing feedback on our YouTube channel and this patient in my office that it seems to be helping.
This is so fascinating. These simple concepts that can really make a huge impact. Exposure to sunlight to combat that increase in oxidative stress happening in the mitochondria, the powerhouse of the cell, and this recommendation of intermittent fasting so that you can burn more fats and have that restorative effect of ketones in the body. These sound
Yes.
like good recommendations no matter what, even without long COVID, honestly, getting outside more and, kind of, you really did a great recommendation of asking us to think about our habits here in the Western world and around the world. I think the cell phones and the increase of social media, although here we are recording a video, that's helpful though, so it's different.
Yes.
But those are really fantastic pieces of advice, and I think it's really interesting if people are curious about, there's so just not to go down another rabbit hole, but there are so many different types of intermittent fasting. You did
Yes.
mention 4
Yes.
to 8 hours, even 4 hours being a period of time. Do you have any resources that you recommend of how to follow? Is there any specific prescription, or what do
So
you think about that?
the one that this gentleman, when I meant to say 4 hours, I'll be clear on that, is that it takes about 4 hours after you eat a meal before your body will go into that fasting mode. What you really want to be able to do is you want to be able to fast for at least 13, 14 hours a day, even higher than that. So to give you some practical times here, if the last portion of your meal at night is at 5:30 in the evening, you can do the math there, and 12 hours will get you back to 5:30 in the morning, and you add about 4 hours to that, eating at around 9 o'clock. And of course, it's difficult to do this because people have jobs, and sometimes they can't be eating on the job. But 14, 15, 16 hours is actually very, very important, and would do what it would need to do. Now, people who do this, there's been studies that have looked at this. There's been some studies that have not shown positive outlook, but there's a study, for instance, that was done in China where they took diabetics and they put them on this meal. And here's the beauty about this. You're not asking them to change what they eat, although it might help. You're not asking them to change how much they eat, the quantity, just when they eat. In these patients that were done in China, there was a 20% reduction in hemoglobin A1C, which is staggering. I mean, that's about the same amount that you would get from a sulfonylurea, for instance, or metformin. Here, you're getting this without any side effects. And so the point I also wanted to make is that there are actual transcriptional changes that occur in your body when you go into a ketogenic mode. When there are ketones circulating, your body switches. The analogy that I like to give is like, we have a park, Disneyland, here in Southern California. And if you've ever gone to Disneyland, you know that it's a great place to go on rides, go to the concession stand, have fun, do all those sorts of things. But what you may not know is when you leave the park at night, that park completely transforms overnight. There are gardeners that go in at night. There are repair people that are doing maintenance on the rides. There are people that are taking the cash out of the cash registers, doing the inventory. All of these things have to happen. And if it doesn't happen, you're not going to have a good day the next day, right? So this is, you have the building during the day and you have the breakdown and repair at night. This is how a park works. And as complicated as Disneyland is, the human body is infinitely more complicated than Disneyland. Think about all of the repair systems that have to happen. Those usually happen at night. And what needs to be happening at night is that our eating and fasting has to be corresponding to our sleeping for those things to work well. Another analogy that I give is, imagine what we have, I live close to Los Angeles. Los Angeles is a city of traffic. And if someone were to tell me, hey, can you do me a favor? Could you go into LA at 8 o'clock in the morning? That's when all the commuters are going into LA. That would be a commute from hell. Okay. It would take about 3 hours to drive in. But if you were to tell me, hey, could you drive into LA at 10 o'clock at night? Forgetting the fact that you shouldn't be up at 10 o'clock at night anyway, but many people are. That's a completely different drive, even though the distance is the same. Even though I'm driving the same distance in the same vehicle, when we do things at the right time, it's easier to do if you're going along with the circadian rhythm of the body.
Absolutely. This is what I'm taking away from this is, the getting our bodies away from this stressful world we do live in now. And I think it's been since 2020, since COVID-19 began, people have been under a lot of duress and in this almost fight or flight state. And you're talking about different, even potential ways to go into the more of the state of being in the rest and digest so that we can repair and restore our body.
Exactly.
So
Exactly. And tying it in to the circadian rhythm is really key. I have been much more aware that there are times when things are going to be much easier to do according to your circadian rhythm. In fact, you might be very interested in being a pharmacist, that I've read some recent articles in the pharmacology literature that they are now looking at the studies that have looked at side effects of medications. And the reason is because they are now understanding that not only do certain medicines have certain side effects, but certain medicines have certain side effects depending on when the medicines are given, the time of day. In other words, you might have a side effect that is more apparent at this time of the day because of cortisol levels, because of things of that nature, versus being given at another time of the day. In other words, the circadian rhythm is a variable that we have not really looked at as carefully as we should have.
absolutely. Salam, any thoughts? Do you have anything to
Yeah,
share?
no, this is very fascinating, Dr. Seheult. Thank you so much for sharing. And I'm just curious because with my experience with long COVID, I had a lot of like the dysautonomia component. And so a lot of like drops in blood pressure, even like my blood sugar, the other day after postprandial, it was like 66, which is, really low. And the reason I bring that up is because it seems like my overall hemodynamics are very impacted by my food consumption and, staying hydrated. And so I'm just curious, if you've encountered patients like myself, and is there a way to maybe manipulate the prolonged fasting in a way where we can still get some benefit, even if I may not necessarily be able to like fast for 14 hours on end?
Yeah, it's not easy. The first thing I would say is that if you're going to do any fasting, you want to do it in a very slow, progressive way to make sure that you avoid exactly those things. One of the things that I find interesting is that in the circadian rhythm, the sensitivity of the body to insulin is highest in the morning.
Okay.
Meaning that if there was a time that you were going to fast, that would be in sync with your circadian rhythm, it would be better to do that in the evening time rather than in the morning time, because of that limitation. So keeping those things in mind, I am very, very cognizant of the fact that it's not a one size fits all. There are people with different metabolisms, and they're coming from different areas. And this is the reason why that we will all never be replaced by robots, I hope, because the practicing of pharmacology and the practicing of medicine is an art, and you have to be able to interact with your patients in a way that you could get them to where you need to be.
Right. Thank you for that.
Yes. I'm going to turn to Dr. Kabbani for a few questions as well, and then I want to hear from both of you how people can reach out to you, because both of you have fascinating things you're doing and contributing to the medical world. But Dr. Kabbani, or Salam, if I may call you
Salam is
Salam, since we know
fine.
each
Yeah.
other so long, could you
Yes.
share with the audience how long you have had long COVID?
Yeah. So I've gotten COVID 3 times, and each time it's added a little bit of long COVID symptoms, it seems. But the very first time was August 31st of 2021. I was out of work for 40 days initially, and then it seemed like I was doing a little bit better. And then things kind of worsened after that. So I went on disability November of 2021. And then I was out until September of this year, and I'm finally back at work doing much better, thankfully. But it was over a year, so yeah, or just around a year.
Yes, and one of the things that was born throughout this time, of course, was the book that you wrote about your journey. And
Yes.
yes, yes. And you've also been researching and connecting with different groups and organizations that are talking about long COVID and doing things about long COVID. Do you mind telling the audience a little bit more about that?
Yeah, absolutely. So initially, when I first got long COVID, I was having the symptoms before I even knew that there was a thing called long COVID. So I was feeling very isolated. And so what helped me was starting an Instagram page and kind of connecting with other long haulers that way. So just on a very surface level, if you type in a hashtag long COVID or COVID survivor on Instagram, you can meet a lot of people that way. Similarly, there are many Facebook support groups out there, for people to connect through. But with regards to resources specifically, there's a website, it's called Survivor Corps. And that is a fantastic website because I believe it shows where there are different long COVID resources and clinics. I believe it's worldwide. I know for sure in the United States. So that can really help people who are maybe thinking that they have long COVID, but not quite sure, just connected to those resources if they're not able to get in with their primary care provider and kind of be redirected through that route. Another website is it's recovercovid.org. And I really like that one because it's basically researching COVID to enhance recovery, I believe is their motto. And so for people who maybe have a little bit more time, if they're not at work, you can actually enroll in clinical trials if you're eligible, or just find out what trials are going on and maybe seeing if you're eligible. So those are really two of like the bigger ones where you can go directly into the medical realm and hopefully find care that way. I was very fortunate, I was able to be on disability and was able to travel. So I was initially treated at the Cleveland Clinic. And then at the time I was living in California. So I went back to the Stanford PACS clinic is what theirs is called. And I'm still actually being treated there at the time. So those are also some other resources. Some other things, I know the CDC has a lot of great information that really breaks it down both for patients as well as healthcare providers. Other than that, I honestly don't know too much, but like I said, if you're searching, through social media or even through Google, there are so many resources out there. And I only imagine that number expanding just based on what Dr. Seheult has shared. It sounds like it's definitely real and it's happening to many people, not just myself. So I hope that the resources continue to expand.
Yes, it's absolutely real. It's complex, it's
Yeah.
complicated. As Dr. Seheult was mentioning, the treatment, you have to really look at the individualized patient, really take a close scan at what is going on and try to identify these factors. And then have you heard about I know we talked a little bit about the fasting, intermittent fasting. Have you heard about going outside and getting more sun? Is that something you want to try to do after
I
hearing this?
definitely want to try it because, we could all use some time in the sun. I actually did not know that information. I'd heard a little bit about the intermittent fasting and I was very curious to try it. But like I said, with my blood sugar, I just, I didn't know if that was necessarily like the best option for me. But no, I'm definitely going to be spending more time in the sun now and hopefully it works its magic.
Absolutely. Well, Salam, you did describe a lot of the different symptoms and experiences you had with long COVID in the book that you wrote, the memoir. What kind of responses have you actually received, especially if you've heard out from anyone that has long COVID about your
Yeah.
book? Could you share?
Absolutely. Yeah, yeah. So a few of my friends with long COVID read it, and all of them have just described feeling so seen, having very similar symptoms. And honestly, just now hearing Dr. Schwell, I almost, I was almost tearing up just because when he was talking about his patients, it's almost exactly what I was going through, when it was at its worst. And it's just very incredible to hear those stories, even though, like, for me, I'm so grateful to be doing so much better now, but still, it's a very it's kind of a grueling experience, especially if, like myself, you maybe are a little bit younger, didn't have any pre-existing health conditions, and then all of a sudden you're hit with a myriad of symptoms that you just can't seem to find a cure for. And so just hearing those stories, it makes you feel seen and heard. And it's nice to know that there are providers out there that are doing their best to help us.
Absolutely. So you mentioned having care with Stanford. Could you tell
Yes.
us more about your study that you're involved in and what's next with that?
Yeah, so I'm very fortunate. I'm currently enrolled in what's called the Stop PASC trial. And essentially, it's looking at 14 days of either Paxlovid or placebo with ritonavir twice daily for, I'm sorry, 15 days, not 14 days. Or no, I'm sorry, for 14 days. But basically 2 weeks of that. And then kind of seeing, are there improvements in baseline symptoms and vitals? Just there's a variety of symptoms that we are tested for at the beginning. And, you're constantly taking these surveys. So the duration of the study, when I first enrolled, was 18 weeks. It's now been changed to 15 weeks. And so you have to actually visit the clinic for a total of 5 visits. And that's where they do a lot of like the assessments. And I'm also enrolled in a sub-study where you monitor you do an EKG test through an Apple Watch, and then you also monitor your blood pressure every day at the same time while you're on the treatment plan. And then after that, it's once weekly for a few weeks, and then once every 2 weeks. So it's really interesting. It is, and I'm going into the statistics of it, but the allocation is for each one person that gets placebo, 2 people will get the actual study drug or Paxlovid. And it's just really interesting because they're saying that a lot of the people they've seen seem to have improved. I obviously have no way of knowing at this stage, but I suspect that I got Paxlovid because it's been like a complete 180. I wouldn't say that my symptoms have gone down to 0, but like I haven't needed to take Zofran in almost 4 weeks, something that I was living off of. Similarly, like I haven't needed to use my cane since December 2nd. There's just so many improvements. So again, obviously we won't know until the very end of the trial, but I think it's very promising that these trials are going on, that people like Dr. Schwell are, kind of thinking outside of the box and putting forth these trials, because it definitely gives me hope for the future. There will be therapies, hopefully.
Yes, that's what I'm hearing resoundingly from both of you, that this is a new frontier and there are these new ways and innovative ways to take care of patients that we're exploring, and there's some confusion and fear sometimes from the patient's perspective, but it's videos that you're putting out, Dr. Schwelt, or hearing about the studies, or finding community and finding others like you're doing, Salam, in the way that you can find hope in these maybe desperate times. So I really appreciate both of you. Salam, since we were just speaking, how can people reach out to you and work with you or find your book? Tell everyone about that.
Yeah, absolutely. So my book is available online. You can purchase it either through Amazon, Barnes & Noble online, or directly through the publisher, Global Bookshelves International. And then with regards to, email, you can just email me at salam@authorsalam.com, and we can post that afterwards. I'm also on social media. My website is salamkabbani.com. I talk a lot more about my long COVID journey there. I also have my long hauler chronicles that I kind of go more in depth about the different experiences and emotions as a long COVID patient on that website, as well as my Instagram that will also be linked here.
Absolutely. And the same for you, Dr. Schwelt. How can people learn more about your work and what you're doing for the healthcare providers, world, students, and everything?
Yes, thank you. So we have a website called medcram.com. And we also are on social media as well. If you type in MedCram into YouTube, we're also on Instagram and also on Facebook. And you can write to me on any one of those platforms, or you can email on the website, and that comes through as well.
Fantastic. Thank you both for this time today. It was a beautiful conversation, very hopeful for what happens in the future, and really hopeful for all the patients with long COVID or people that may know someone who has long COVID. Thank you for your time and all the best.
Thank you.
Thank you.